Hi, I'm Andy Miller. I'm the Executive Vice President for Mission here at LiveStrong, and by training I am a health educator. So it was great to see so much interest from our constituents around HPV, human papillomavirus, what it is and how does it relate to cancer. So we thought we'd take a few minutes to answer some of those questions. Another question was, what are the risk factors for HPV and how do people get it? And then what are the preventive measures that someone can take in order to reduce their risk? Well, like I said, HPV is a sexually transmitted disease. So all of the same practices that people use in order to practice safer sex apply with HPV. But they're not always 100% effective, and I think that's important to know. Most people will not develop symptoms with HPV, and in really 90% of the cases, people's own immune system will take care of it. So sometimes it's hard to even know when you should be concerned as to whether or not you could pass on the infection to a potential sexual partner. So it's probably the best bet to always practice safer sex practices. For most people, that means the use of condoms. However, HPV can be passed through genital-to-genital contact or through oral sex, and a lot of people don't use condoms in that regards. So the best bet in order to maximize condoms efficiency is to use them before any type of sexual contact begins, and to use them consistently and correctly through the entire sexual contact itself, and then discard it afterwards. That's really the only way that condoms are going to be maximally effective. But because, again, HPV can be spread through just touching one another, sometimes condoms aren't completely effective. Another way to prevent it is through vaccination. And there are vaccines available for both men and women to prevent them from certain strains of HPV. Really, the only other way to 100% prevent HPV infection is to abstain from sexual activity altogether. For most people, that's not realistic, but in terms of a 100% guarantee, that's really the only way. Obviously limiting the number of sexual partners that you have, and consistently and correctly using condoms can significantly reduce your risk, but they're not 100% effective. One of the first ones was, a lot of people know that HPV causes cervical cancer, but does it cause any other types of cancer? And the answer is yes. HPV can cause not only genital warts, but a whole host of other cancers. And the strange thing is, the type of HPV that causes genital warts is oftentimes a different strain than causes different types of cancers. But in addition to cervical cancer, it can also cause cancers of the penis, cancers of the vagina, cancers of the vulva, cancers of the anus, and even cancers of the head and neck. A lot of people don't realize that HPV can actually be passed on through oral sex, and someone can their head and neck can actually become infected. Another question people had is, if I have been infected with HPV, how do I talk to my partner about it? And this is really an important one and a sensitive one. The first question you're going to have to ask yourself is the relationship I have with this person serious enough where we're actually considering sexual activity together? And if that is the case, and you do know that you have been infected with HPV, the responsible thing to do is to disclose that to your partner. But you want to do it in a way that's empowering to the both of you to make good decisions. So the first thing I would recommend is get the facts. Arm yourself with the information about HPV, what it is, what it isn't. It's a very common sexually transmitted disease. Most people have been exposed to it or will be exposed to it in their lifetime. It does not mean that someone is promiscuous. So you want to make sure that you're able to statistically say how many people have been infected with the disease. You want to be honest with that person. You want to make sure that they know that you're telling them this because you care about them and you want them to be fully aware. I would always say put yourself in the other person's shoes. If the positions were flipped, wouldn't you want to know? The other thing to consider is give the person time to think about the information that you've just shared with them. Give them space to react and to think about it. And hopefully they will come to the conclusion that this is something that's a fairly common virus that many people have, and there are ways that you can prevent transmission. So hopefully the next conversation you will be having is how can you put practices into place in order for you to have sexual activity, but also to minimize your risk of HPV infection. But the reality is, most of the time, if one partner is infected with HPV, especially long-term partners, both partners tend to be infected with HPV. The reality is, though, many people will never exhibit signs and symptoms. It is a very common virus, and again, 90% of the people will clear the virus on their own, and it's not harmful. However, there are 8 strands of HPV that do cause cancer, so people do need to be vigilant, for women especially, to get pap and pelvic exams on a regular basis, to talk with their doctor about their sexual history so that they can be screened appropriately.